was pretty traumatic. I didn't know what to expect.
An Tu-O was getting things in order just one day before a scheduled C-section. She was 39 weeks pregnant when she had a heart attack.
I was just laying in bed, and all of a sudden I just started having like chest tightness and like shortness of breath.
She tried to brush it off, but when the symptoms didn't go away, she called her doctor, who told her to get to the hospital.
I got to the emergency room. They did a lot of different tests for me. They were concerned because I was pregnant, so they had to do extra precautions for x-rays.
She was transferred to Providence St. Vincent's cardiac team, who, to her surprise, told her she suffered a spontaneous coronary artery dissection, or SCAD.
A SCAD heart attack is a heart attack, so the classic heart attack symptoms are the same.
Providence cardiologist Lori Tamt says these sorts of heart attacks are most common in younger women, especially during pregnancy, and bring risk to both the mom and the baby.
Moms whose heart is not working properly can't get blood flow to the baby either.
Other risk factors include changes in estrogen levels or triggers like intense exercise or emotions. O says she was exercising and eating well. Dr. Tam says there wasn't anything she could have done differently. That's why it's important to pay attention to symptoms like chest discomfort, pain, tightness, or heaviness.
I think people shouldn't ignore symptoms because my symptoms did go away within like 10 minutes, but I'm really glad that I went in. Things turned out well. Yes, had a healthy baby boy.
In Portland, Julia Lopez, Fox 12 Oregon.